At SASH in Western Sydney, Alex and the emergency team are faced with a desperate situation.
CPR, yes or?
13-week-old puppy Lucy has been rushed in, suspected of having the deadly and highly contagious canine parvovirus.
Got an IV in?
Parvovirus affects usually young puppies because they don't have good immune systems. There is a vaccination for it, and when they're not vaccinated, unfortunately this virus can be invariably fatal if not treated very quickly and aggressively.
We need the end tidal as well. Can someone get the end tidal?
Some of the symptoms of parvovirus include vomiting and extreme diarrhea, which can cause rapid dehydration and damage the intestines and immune system.
ECG on, please.
When a pet presents to us and we suspect that there could be parvovirus, we do need to do a patient-side test similar to a COVID test. And while we're waiting for those results, sometimes the animals can be quite critical.
Can someone feel for a pulse?
Little Lucy is fighting for her life.
Monitor on.
Her heart has stopped, and Alex and her emergency team are working frantically to try to save her.
Who's on next? Who's on next for compressions?
If you want to go.
I'll listen.
We
got a heartbeat, we got a heartbeat.
Okay, good. Let's put this ECG.
Keep breathing. Can someone feel for a pulse? If you can't feel a pulse, we might have pulseless electrical. No,
No pulses.
no, are you sure?
Can't feel them.
They were very weak to start.
Okay, well, I'll breathe and you can feel for a pulse.
Yep.
No. They're not coming.
Yeah, we got a pulse. It's just very fast, yeah.
Yep.
We're just gonna keep listening to that heart. Our end tidal's dropping.
Do you want adrenaline?
You got IV?
Yep.
Just give 0.05 of a mil. Okay, I'm gonna start compressions again.
Can I get some tape?
Little Lucy is barely clinging to life.
We'll do another round of compressions.
This puppy's situation is so critical, I'm quite concerned that she might pass away shortly.
I can't compress any harder. The chest is collapsing.
Vet Alex is fighting to keep Lucy alive after the young pup's heart stopped for a second time.
Are we getting fluids in? We need fluids.
It's suspected that Lucy has parvovirus, which can be deadly and is highly contagious.
Have you got a pulse?
Restart compressions.
I can't hear anything. Are you sure you've got a pulse?
Yeah.
No, keep going. Keep going.
At the moment, there's a lot of parvovirus happening in Western Sydney. There is a reduced amount of people vaccinating their pets against parvovirus, and it does spread from dog-to-dog contact, and so when people are out and about, it's more likely to spread to pets that aren't vaccinated.
Someone listen, someone listen. Oh, I can see a heartbeat. There we go. Listen. Yep, I got a pulse. I've got a pulse. I've got a good pulse, strong. Keep breathing.
Okay, that was a breath on her own.
That was a breath on her own?
Hey, good puppy.
Okay.
Oh, very good.
The team is suddenly optimistic.
Have we got a parvo test result yet?
Oh, I'm sorry, Papa.
But then, devastating news. Test results confirm Lucy does have the deadly virus. The emergency department is being closed immediately to prevent the spread of the killer virus.
Parvovirus is incredibly contagious to other dogs, and especially in a hospital setting where we have lots of very sick and debilitated animals, young puppies that may not be fully vaccinated, this can spread very easily in the hospital and infect some of our patients.
So these are agonal breaths. These are not normal breaths that she's doing at the moment.
We've had 2 cardiac arrests that we've been able to successfully resuscitate now, but we're on the brink of potentially having another arrest. So we need to very closely monitor, because this breathing that we're doing at the moment is very concerning. It's brainstem breathing. We just need to be really careful to make sure that she doesn't re-arrest.
Guys, get ready. She might be going again. We've brought her back twice now, but she might be going again soon.
Hopes are now fading, with her heart stopping for a third time.
Quite frequently we do CPR, we bring them back, and then they rearrest quite soon afterwards. Yep, she's gone.
Despite everyone's best efforts, little Lucy has lost her battle against this terrible virus.
We are very frustrated as vets because we always think that an ounce of prevention is better than a pound of cure, and these things could easily be prevented by making sure that your pets are fully vaccinated.
So the whole hospital is now contaminated with parvovirus, essentially. The suction will need to go.
Parvovirus can't be passed on to humans, but humans can pass it on to other dogs. So now everyone must be vigilant.
Chuck the incubies. We'll do a full restock.
So we've had to lock off areas of the hospital while we do a deep clean to allow the virus to be killed so that we know that our hospital is safe again to start receiving sick patients.
4 dogs with parvovirus were brought into SASH in the last 24 hours, and 3 of them, sadly, didn't make it.
In an ideal world, we would see everyone's pets vaccinated unless there's a health condition that means that they can't be vaccinated. Is a really tiny thing that we can do to prevent such a serious thing from happening.
In Sydney, worried owner Greg has brought his puppy Daisy in to see Michael, a new member of the Bondi Vet team, hoping he can sort out a problem with the little dog's eye.
You've been a good puppy. Here he is.
Hello, Greg.
Hello, how are you?
Good, I'm Michael. How are you?
Good, thanks. Yourself?
This must be Daisy.
This is Daisy.
Hey,
She's
sweetheart.
my little 11-month-old child.
Yeah, very sweet. And she's in for her eye today.
Yeah, we noticed that a week or so ago that the right eye started to get a bit blistery.
Yeah.
I thought it was an infection.
Yeah, it's quite swollen in that right eye, isn't she?
It's not annoying her that much, but it is weeping.
Yeah, no, we'll definitely have a look at that. Alrighty, do you want to come through and we'll
Yeah,
take
sure.
a close look?
Come on, we'll come in and see the doctor.
Come on in, Daisy. Up on the table.
Here we go, sweetie.
Perfect.
Up on there. Good girl.
Let's take a close look at your eye, hey? Good girl, Daisy. And there's that discharge that you were talking about just sitting at the corner.
It gets that yellowy sort of conjunctivitis discharge that I've got to wipe away with the tissue constantly all day long.
It's definitely not normal that we can see such a big kind of red lump there. So I've had a closer look at Daisy's eye, and my concern is that I can see discharge, I can see redness. It's obviously inflamed. Daisy's rubbing at it and she could do even more damage now that it's irritating her. So we really need to sort this out straight away. Now that I've had a look, I can see that it's coming out from the corner of her eye, just behind the third eyelid. And this is actually the gland that produces some of the tears in the eye that's poking out.
Okay.
What we call it is a cherry eye because it looks like a little red lump. It's a normal structure, it's just completely where it shouldn't be. Worst case scenario is that Daisy stops producing tears properly and the eye can dry out, and the tears are a really important way that the eye protects itself. So if she keeps scratching at it and becomes sore, we could get an ulcer, and in some cases, ulcers result in removal of the eye if they can't be treated, and that's what we want to avoid. My concern is that, without surgery, it's just going to stay out and it could even get bigger. And if it grows bigger, it could interfere with her vision and the function of the eyelids. What I was thinking is that we take her to surgery today and we do a procedure to get the gland back into where it should be, but preserving the function of that gland.
Okay, that
How's
sounds
that
like
sound?
sounds like a plan.
How's that sound, Daisy? Is that good? Goodbye, Dad.
Okay, all right. See you when you come back.
See you with a new eye.
All right, thanks for that, Doc.
No worries, see you later.
We're a little bit anxious. There's always a risk with any sort of surgical procedure, I suppose. I just hope that everything goes fine. I don't want her to have an issue with her eyesight.
Alrighty, so we're just going to test her tear production.
Michael is checking Daisy's tear production by the gland itself to make sure it's still working properly, before delicate surgery to try to get the swollen gland back into place.
That's really good. So we've got about 21 millimeters of tear production, so that's brilliant. Alright, let's get her pre-med. Perfect, yeah, that's good. Yep, brilliant. think we're ready to cut.
Repairing a cherry eye is a simple procedure, but it's also risky.
This gland is literally touching the cornea, which is the front of the eye. This is really swollen and I've got such a small space. I'm looking at it thinking, how am I actually going to get this gland into such a small pocket? There's no room for error with this surgery. Every move I make, I can literally see the eyeball move behind the gland, so I know that I'm quite literally millimeters away from the eyeball, and I'm using really sharp, pointy instruments. I'm using some scissors now, which are really sharp and pointy, and I have to actually point them towards the eye. Okay, moment of truth, just taking these retractors off. It's in, it's good. We fixed your eye, Daisy. We're going to wake Daisy up. She's probably going to be a bit sore. There's going to be a lot of swelling, so we're going to give her some good pain relief, good anti-inflammatories. Good morning. Clean up her eye and then just nurse her to recovery so she can meet her dad again. Good girl, Daisy. Nice and brave. Good morning.
In Sydney, Daisy is recovering well after Michael repaired her uncomfortable, inflamed cherry eye.
Good girl, Daisy.
And now owner Greg is anxious to see his little girl.
It has been a long day. It's been a little bit stressful, wondering what the outcome was going to be. I was glad to get back and see how things have gone.
Here she is.
Oh, hello.
Where's your dad?
Good girl. Oh, hello. Look at your sore eye. Okay, so how did it all go?
Everything went really, really well. I'm very happy with how the surgery went. The gland's back in where it should be, and her eye's going to recover really well. So we'll just give her some medication to keep her comfortable.
Excellent, thank you.
So unfortunately, she's going to have to wear a cone on her head, so she'll look like a lampshade for a little while. But it's really important just so that she doesn't scratch her eye and undo any of the stitching in there.
Okay. What a good girl. Certainly not a fan of the cone by any means.
The best part for me as a vet is to be able to fix a problem. She's come in with a cherry eye, she's come out with a normal eye, and to be able to reunite her with her owner, that part really does it for me.
Thanks very much for all your time and help.
No worries at all.
All right.
Take care.
We'll take
Bye,
you out.
little one.
Say bye-bye. We'll see you in a week or so.
Ready to go?
Okay, come on then. Off we go. Good girl.